Causes of infertility. We will categorize them broadly into female causes, female factors, male factors, and now factors that affect both the male and the female. So for the female causes, you just come to the reproductive system of the woman. So you can have cervical causes. The cervix can be blocked. Either you are born with it like that, or you have had surgery on the cervix for whatever reason. You had maybe a lesion that needed to be removed, a growth, and then it healed by narrowing, all right? Or another factor where we say the cervical mucus is hostile to the sperms. So when the sperms reach here, they are killed. Let me just put it that way. So they are not able to ascend. So those are cervical factors. Then we come to uterine factors. Again, the uterus can have congenital abnormalities. You see this nice triangle, and we shall discuss congenital abnormality of the uterus one day. So you can have a uterus that is not shaped normally. So the issue of implantation, the issue of carrying pregnancy, actually congenital abnormalities are more big on what we call pregnancy wastage, miscarriages, biconjugate uterus, didelphys. I'll just use those terms broadly. Then also they can now be acquired things in the uterus. These ones we know, the fibroids, the polyps. Maybe you've had surgery inside your uterus and then it healed with scarring, Asherman syndrome. So here, when the fertilized egg comes to try and implant, trouble. That is a cause. Then we come to tubal factors. That the tube is narrow, or it is blocked, or you are even born without a tube. Congenital abnormalities. We always have to keep that at the back of our mind, especially in primary infertility. So things like infection, other surgeries in the abdomen. Maybe you had your appendix removed, and then the healing of the appendix, somehow the tubes got stuck on the scars and then they got blocked, or they are not necessarily blocked, but they are not free, you know. Even things like pelvic inflammatory disease, they heal with scarring. Remember, the egg is released, and this tube is not stuck the way it appears here. It is like, I like to say like an octopus. So when the egg is released, it has to go and grasp that egg. If it is stuck somewhere, that mechanism is affected. So those are tubal factors. Then there are ovarian factors. The key thing is our ovary giving us an egg, ovulation. Now that is where you come the issues of irregular periods. We tell you are likely not to be ovulating. Thyroid disease, prolactin disease, you know, things like diabetes. Those affect ovulation, or even ovulation, ovarian cyst will affect the process of ovulation. So all those are female factors that can contribute to infertility. And so when we come to management and evaluation, we have that at the back of our mind. Now,